Matthew Bell with Alzheimer'sProof.com, and today I wanted to talk just a little bit about some of the things that you might expect if you are trying to get a loved one or you yourself are trying to gain admittance into some sort of senior living facility. Now I have another video, and I'll put the link in the description, where I describe different care environments. So one question is, if you needed some kind of long-term care, where would you want your care delivered? And I go into 6 different environments where long-term care is generally delivered. But in general, it's either going to be in an institution or it's going to be at your home. If it's going to be in an institution, there are certain intervention levels that are going to be tailored for different institutions. So you might have an independent living institution, which is essentially like an apartment complex. They're not going to help you do anything. If you live in an apartment complex, there's nobody to help you get around. There's nobody to deliver medications to you. If you live in an assisted living community, then in that community, you may have certain limited assistance with mobility, with diet. There may be meal preparation and things like this. If you live in a nursing home, then there's even going to be a higher level of care provided. There may be custodial care, helps with the activities of daily living. There may also be medical interventions or what is called skilled care. Other services, and again I get into these in another video, things like adult daycare, hospice, respite care, these can all be seen as assists and as special cases, things that can help a person, let's say, with home care. So if your primary provider of care is your spouse, but the spouse still has a part-time job, then that spouse may drop you off at adult daycare while he or she is working. If the spouse needs a break and you are being cared for in the home, they may take you to a respite care facility. If a person is in need of end-of-life services, then you may be taken to hospice, whether or not the person was being cared for in the home or in an institution. There can be any number of background stories, essentially, to how a person lands in an institution as well. It could be a transfer from a rehabilitation center, from a hospital. They might come from home. They might come from some other skilled nursing facility. Once again, I have a video where I describe the differences between custodial and skilled care at greater length, so I'm not going to get into a whole lot of that here. But let's just say, in general, we want to talk about a retirement community. So in a retirement community, generally speaking, it might be a place where you might expect your neighbors to be attaining an older age. So for example, it might be an area where people are, quote, seniors, and this could be variously defined. It might be retirement age, 59 and a half, 62, 65, 66 and 2/3 if we're thinking Social Security, 70 years old. Retirement community essentially simply means that the people who are living in that community are generally slightly older adults. Once again, an independent living community would be one in which you do not require any additional help. You are able to perform all the functions of daily living. You do everything yourself. You may have a kitchen in the place that enables you to prepare your own meals. It's like an apartment. In an assisted living community, however, you may receive help with the activities of daily living. And generally, these are enumerated as 6 different ones. Being able to bathe yourself, feed yourself, dress yourself, toilet by yourself, keep control of your bodily functions, that is, maintain continence, and being able to transfer in and out of bed by yourself. If you require help with those, then that would land you either in an assisted living community, or for a notch above that, it would be in a nursing home. Now, a nursing home is going to add on to that custodial care, the care with the assistance with those 6 daily living activities. Nursing home is going to add on skilled nursing care, and that is going to be care you receive from some kind of a medical practitioner. A nurse, a doctor, a therapist of some kind. May include wound dressing, the administration of medicines, may include different therapies like speech therapy, different diagnostic tests, and the like of this. Now, assisted living is generally for seniors, but in fact can accommodate anyone who is 18 years old or older. So if somebody gets involved in some kind of an accident and they are disabled, or maybe they have been born with some congenital defect or some other kind of difficulty, they may require assisted living at any age. An assisted living facility is going to provide some limited, usually, care or help with the activities of daily living. Usually that's going to basically focus on some mobility aid, possibly meal preparation, possibly meal delivery. But assisted living facilities are generally not going to provide 24/7 around-the-clock medical care. They may or may not have a full-time physician or nurse on staff, probably have one on call, but they probably will not have one that is available 24/7 They're usually not going to be suitable for people who have cognitive impairments or severe disabilities. So, for instance, if a person is well advanced in some kind of a dementia or Alzheimer's disease, probably not suitable for an assisted living, particularly if they are at risk of elopement or of wandering away from the facility. Cognitive difficulties, once again, can include this elopement risk, which is the word for when a person leaves the care environment without knowing where they're going necessarily, without alerting anybody. I want to say without permission or without authorization. It sounds bad, but that's the reality when a person gets to that point in time of diminishment of their cognitive capacities. Then they are essentially childlike in that regard. They may have emotional problems like my dad did, aggression, aggressive behavior, belligerence. They might have depression. They might have inappropriate public displays. That could be of all different types of things. And they may also have some sort of physical disability, and usually these can get severe simply with old age. For example, they might be wheelchair bound or otherwise immobile. So when you are trying to gain entrance into an assisted living facility, in general, you're going to have to demonstrate that you have the ability to get around by yourself. You're going to have to pass a medical exam, a physical exam, possibly a stress test, maybe an x-ray, a script check, that is to say a check for prescriptions to make sure that you're not on any kind of drug that would be prescribed for cognitive impairment or other severe medical difficulty. They'll pull your medical records, what's sometimes called an attending physician statement. It's basically a statement that a doctor would write regarding the state of your health. And if you are not suitable for assisted living, that is to say, if you do have some sort of medical problem, some sort of disability, an enfeeblement, or some kind of cognitive impairment, then for the most part, the nursing home would be the only game in town. So nursing homes are often going to be doctor ordered in the sense that once you are certified as long-term care needy, some kind of deficiency for insurance purposes, it often means that you lack 2 out of 6 of the activities of daily living that we just sketched earlier, or you have some kind of cognitive impairment. If that's the case, then you probably wouldn't qualify for even assisted living, would have to go right to a nursing home environment. If you found something of use in this video, please like it, please subscribe to the channel, click the notification bell. This will alert you to new content as it becomes available. I appreciate your time today. I look forward to seeing you in another video, and I wish you all the best in trying to plan for you or your loved one's extended care. Thank you so much.